Hi guys, welcome back. In this video we shall be talking about bronchial asthma. So what is bronchial asthma actually? Please try to understand whenever you take your breath, right? This air goes to your trachea. It will go from your nose, from your nasopharynx, oropharynx, hypopharynx, and to trachea, then to primary bronchi, secondary bronchi, tertiary bronchi, then to bronchioles, to air sac, alveoli. This is where, this is how your air travels down there. Right, in bronchial asthma, what happens is that mainly your bronchi and bronchioles, right? This area there's inflammation. There's inflammation due to a stimuli. Rather, I'll say it in this manner: it is hyperstimulation of this area, hyperstimulation of the airway for some antigen. This means your body is hyper reacting to some antigen. This antigen can be your dust, it can be your animal fur, can be perfume, can be some food, can be some drugs like beta blockers, can be aspirin, also a drug, can be due to temperature change, can be due to exercise, can be due to prawn, fish, peanut, right? Can be due to certain kind of smell and certain kind of perfume. So these are the things that can actually trigger your bronchial asthma. So in short, we don't know the exact cause of bronchial asthma, but we know what are the triggering factors, right? So as I told you, there will be inflammation of the airway, of the bronchi and the bronchioles, right? So why is there inflammation? Because of this triggering factor. Because whenever we inhale something, our body sees it as a antigen, as a foreign body, and our body tries to throw it out. That is the reason when you go to a dusty room or something, you start to sneeze. But a person who is having bronchial asthma, he will exaggerate all these symptoms. So there will be so much of sneezing, nose block, discharge might be coming out, and then the airway that is having the bronchioles and the bronchi, that can actually constrict. Rather, it's not actually constricting. There's inflammation, there is histamine release, so there's a lot of mucus and secretion release. So the airway, the inner lumen is reduced. So that is the reason you're having difficulty in breathing. So if you go and see a patient, and if you are yourself having bronchial asthma, so you'll be having is chest tightness, you'll be having chest tightness, and you'll be having wheezing. That is, you can hear the sound, the person is actually wheezing, right? Third thing, the patient will be having cough, he'll be having cough, he might be having shortness of breath, difficulty in breathing, chest tightness, cough, right? He'll be might not be able to complete one entire sentence, he might need to take a break, or sometimes if he is doing a lot of exercise, these things are exaggerated. So this is how you know that you're having bronchial asthma, right? So now, one thing that you have to remember in bronchial asthma, it is reversible bronchial change. That means it is reversible obstruction. This obstruction is not permanent. If you give a drug, this obstruction is removed. So now, what are the drugs that we can use? So imagine, like we are, as I told you, the lumen is getting inflammation is occurring in the lumen. There is a lot of secretion going there, so the entire lumen is reduced. So we'll give a drug, some drug, something like that, that it can actually dilate the bronchioles, right? So that is the reason we give bronchodilator, right? Example is very common is salbutamol. We will be giving a drug that is known as salbutamol. It will actually it is a bronchodilator. The word itself is bronchodilator. It dilates the bronchioles, right? So once it has been dilated, so the air can enter very easily. So the wheezing will be reduced. You can breathe properly. There will be no chest tightness, right? So this is how you know that you are having bronchial asthma. This is the basic treatment there. Now, how will you diagnose that you are having bronchial asthma? You go to the hospital. The first thing first, the doctor is going to see, take your entire history. Okay, are you having this? What were you having? You're having chest tightness. Okay, you're having cough. Okay, you are having wheezing. Okay, are you having cough? Yes. Okay. Are the symptoms more at night and early morning? Yes. Yes. Okay. These all things favors that you're having bronchial asthma, right? And you are having difficulty in breathing. Also, shortness of breath is also there. Yes. Okay. Right. So, do you have excess allergic reaction if you go to some certain dusty place or something? Do you sneeze a lot more than your normal individual or normal more than your colleagues? They'll say, okay, yes. Or are you having sinusitis? You're having sinusitis, no? Maxillary sinusitis is there, frontal sinusitis is there. Are you having sinusitis? If he says, okay, yes, very high chance that you will be having bronchial asthma. Are you having any polyp in your nose? If you polyp is, it's a mucus that has been prolapsed mucus, we say. It's polyp means it's just like a small tumor that is arising in your nose. It's causing actually causing obstruction to you breathe, right? Are you having that? Yes. If you have this, yes, you can develop bronchial asthma also. So once this thing is done, he will think, okay, he's having bronchial asthma, so let me do some test. So there is some test known as FEV1. He will tell you to blow. He'll tell you to take a deep breath and blow it in a tube. It's a machine. It says how much amount of air you're able to push out, right? So he will be doing something known as FEV1. He will be telling you to blow out and will be measure what is the FEV1. He will measure that. Then he'll be giving you salbutamol. As I told you, he'll give you something to dilate, or he'll be giving something corticosteroids, right? Once he gives corticosteroid, the inflammation will be reduced, and then he'll be telling you to blow it again after some time. If if the symptoms improve or the FEV1 increases more than 15%, then we are sure that you are having bronchial asthma. Or also he can do test. He can tell you to run in a treadmill or do certain kind of exercise. After 6 minutes, if the FEV1 reduces by 15% or more than 15%, that is also telling you that you might be having bronchial asthma. With this, he might be doing your complete blood count. Your eosinophil count will go up, right? It will show that you are having allergic reaction. Next thing he might be doing in chest X-ray. The chest X-ray, the lungs will appear as bigger, right? It will be something like hyperinflated lungs, right? Along with this, he might be doing a skin prick test. Now, what is the skin prick test? Skin prick test means you are trying to find out what kind of allergy you are having. Are you having allergy due to peanut? Or are you having allergy due to grass? Are you having allergy due to animal? Or are you having allergy due to dust? We will be trying to find out what is your allergy you're allergic to, right? Once this thing is done, now he will plan to do your treatment. Now treatment will be this thing will be having your medications, will be having certain kind of exercises, daily lot of exercises, chest physiotherapy. With this, they'll tell you to manage your stress, right? Breathing exercise will be there. Along with this, they'll tell you to avoid the allergen. If you avoid the allergen, you're in a very good hand. You have like done a very good job if you avoid the allergen, right? So what are the medications it will be giving? As I told you, to dilate the bronchioles, just dilate it, bronchodilator, salbutamol. He'll be giving you salbutamol. If this thing is working, well and fine. If this thing is not working, he'll give you a long-acting bronchodilator. That means a certain kind of drug that works for a more longer time, long-acting. If that thing is failing, then again he'll give you inhaled corticosteroids. Still fail, he'll give you double the dose of inhaled corticosteroid. Still failing, then he might go and give you oral corticosteroids. Still failing, he'll give you montelukast. Let me tell you, all these things are stepwise pattern. Okay, so if somebody is taking corticosteroids, oral corticosteroids, he should be taking inhale. He'll be taking salbutamol. All these things are there. It is like add-on therapy and stepwise therapy, right? So if this montelukast is also not helping, then he will be going to give you certain kind of newer kind of drugs. Generally, you don't need to go to a certain extent that you need to go and get the newer drugs. Mostly, if you can come to corticosteroids, oral corticosteroids, or maximum montelukast, you are very good to go there. You don't generally need to go to certain high degree. If you go to that, oh yeah, that's a very big problem. So you need to take very good care of yours, right? So this is what a short video about bronchial asthma. So the entire, if I want to summarize the bronchial asthma, please try to understand it is a reversible airway obstruction, reversible, right? So you'll be having symptoms. What will be having? Chest tightness, you'll be having cough, you'll be having shortness of breath, you'll be having wheezing, you'll be having this symptoms will be more at night or in the early morning. You'll be having cough, as I told you. Then you'll be might be having allergic to something. You might be having a polyp inside your nose, or you might be having maxillary sinusitis. These things can be there, right? So the entire thing is that your airway is hyper responsiveness. It is due to the hyper responsiveness of the airway. Even if I'm not having bronchial asthma now, I go to a dusty room, my airway will respond to it. I will be releasing histamine, I will be sneezing, my nose will be having discharge, right? I want to come out of the room, I might be coughing. So this is normal. This is my body is actually trying to throw the antigen, the dust, the bad particles. But if I am having bronchial asthma, my body will over exaggerate than normal. So it is going in reverse direction and attacking me myself, right? So that is the reason your airway will be compromised. There will be no air going into it. And one more thing I want to tell you, that if you hear a patient is having wheezing, it is far better than no wheezing. Generally, if I'm having wheezing, everybody is scared and everybody will bring me to the hospital. What is happening to him, right? I'm wheezing at the home, and then I don't have wheezing now. I don't have wheezing now. So what will happen if I don't have wheezing now? People might be thinking, okay, this guy is not having wheezing now, so he's perfectly fine now, right? It's not the actual cause of this. This means whatever the air was going through the lumen, the complete air is blocked now. So there is no air going through it. So there is no wheezing, because the airway, if it is having inflammation inside, there is a swelling. So there is turbulence. If there is no turbulence, that means there is no airway going. There is no air going. The airway is completely smooth, so the air can travel very easily. There is no turbulence. There is no sound. But in certain extreme cases of bronchial asthma, it is so much inflamed that it can actually collapse. It can actually close inside. So if it is closing inside, there is no air going in. No air going in, so there is no wheezing. So this is something known as silent chest, and it is very, very dangerous. So if a person is having wheezing and he stops wheezing, be very, very, very careful. This is silent chest, and it is going to the very, very dangerous side. That means there's no air going through it. So that is the reason you should be careful. Look out for the symptoms. Have a basic idea. Go and meet your doctor. Talk to your doctor. Bronchial asthma is very common in old age, like 60 or more, or in young children. It's very, very common. And if you are getting exposed to all these things, allergen, you will be having chance of triggering the bronchial asthma. Exactly, right now we don't know the cause of bronchial asthma. We know the triggering factors of bronchial asthma. So that's all for now. I'll see you in the next video. Thank you.